Now, I do know that I was reading a report a few months ago actually, and it was talking about like traditionally about 65% of healthcare spend on benefits is typically wasted as a result of lack of education, lack of easy access to it. I mean, a lot of things that are included into your package from your broker are kind of like the car thing that you really don't need, but you need this one specific thing in there. How are you going about educating the employee and the employer of this waste? In it's kind of a two question there, but
No,
I'm
that's
kind
yeah,
of curious your thoughts.
that's a great question. Again, what these employers get is the brokers package it up and say, there's this copay, there's this co-insurance, there's this deductible, there's this out of pocket. They just package it and say, here, employer, let's here's what your options are. We have a gold, we got a silver, we got a platinum, whatever. And so they present that to the employer, and the employer shrug their shoulders based on cost alone and make a decision. Line by line, there's some things that might be too high, too low, some things that might drive traffic to the wrong places, some places, or others that might prevent people from getting something that's more cost effective. And so we try to look at those types of things on a line by line basis to make sure that we're pursuing affordable, good care. Like, for example, is there an automatic charge for an ER visit that doesn't have an admission following it? Is there a better rate, like no copay, for telehealth as opposed to so looking at some of the line items to make sure that mentally the employees are pointed in the right direction is one of the things. And then it comes down to employee education after that, and that's always an uphill battle. Again, that new hire, you sit them down for 20 minutes, if you even sit them down, but they look at these 3 health plan and 2 dental plans and a vision plan, and you're asking them to make an informed decision on things like, copays, co-insurance, deductibles, out-of-pocket maximums, limits, stop. They don't understand that stuff.